Welcome to the Our Healing Journey podcast with Metabolic Psychiatry with Diane and Michael. Remember, this show is for information purposes only. Consult your medical providers for your individual medical needs. On with the show.
Okay, welcome everyone to our very, very special episode. This is our episode number 3, and we are thrilled to let you all know that we have Dr. Georgia Eid with us as our special guest. And before we begin, I'd like to just do a little intro to let you know how amazing she is if you don't know already. So Dr. Georgia Eid is a Harvard-trained psychiatrist specializing in nutrition, science, brain metabolism, and mental health. She has 2 decades of clinical experience, including many years at Smith College and Harvard University Health Services, where she was the first to offer nutrition-based approaches as an alternative to psychiatric medications. She teaches a continuing medical education course in ketogenic diets for mental health and writes about food and the brain for Psychology Today, dietdoctor.com, and her own super awesome website, diagnosisdiet.com. It's been a long day. Dr. Eid's groundbreaking book is titled Change Your Diet, Change Your Mind, a powerful plan to improve in mood, overcome anxiety, and protect memory for a lifetime of optimal mental health. And I don't leave home without it, kind of like the American Express card. Here it is. And almost done here. 20 minutes later, just kidding. Dr. Jason Fung, who's a best-selling New York Times best-selling author of The Cancer Cure and many other books, says Dr. Eid is one of the very few psychiatrists who understands the critical connections between food, brain metabolism, and mental health, and who can explain them in ways that are engaging and accessible to professionals and the general public alike. You don't get better than that. So without further ado, I leave it to you, Michael.
Welcome, Dr. Eid. It's so great to see you.
Likewise, and thank you, Diane, for that really, really nice introduction. It is an honor to be one of your earliest podcast hosts. So
Yes.
Hey, will you be our host?
We've all belonged to
Yeah.
Our third host now? No, just kidding.
No, we were fortunate to meet you in person in the fall at the first Metabolic Psychiatry conference that had CME crediting, I believe, that Ellen Horn and Dr. Matthew Bernstein put on, and it was an honor. And so, thank you for being here. And yeah, Diane, I think you have a great question to start.
Oh, I have so many questions. And then I had people, we were so excited. We let the cat out of the bag and told a few people that you were coming. And then we got deluged with 30 more questions. Whoa. But don't worry, we cut them back. So one of my burning questions, you're going to love this. What is the one question you wish people would ask and they never ask?
Oh my goodness. That's a really good question. I guess I wish more people would be curious about, I feel like audiences for this kind of information fall into 2 camps. So there's the ketosis camp, and then there's the nutrition camp. And I wish more people would ask questions about how those 2 play together, because I feel like most of the questions that I get are either directed to one or the other, but I think that they really are connected. So, ketones are one thing and nutritional quality is another thing, but it's really, you get your best benefits when you combine information from both of those worlds. That's when you get your maximum power out of your dietary changes. So I wish more questions would be kind of roll those 2 things together rather than separate them into 2 separate issues.
Yeah, right. Like there's so many aspects, like, vitamin B9 and B12 for some people, and, methylation, things like that too. There's so much to that can affect the mood.
Yeah, I find food really fascinating. And so there's the food piece and there's the ketone piece. And I'm really happiest when I'm thinking about both of those things.
Right. So for me personally, I've had some medical stuff in the past month that I went through that was really tough. And so this made me think of something really great because I had to coach myself. And I found that intermittent fasting combated the stress I was going through for the infection I had in my GI tract. And I ended up in the hospital at the end, this week because of it. It got so bad. Um, but my glucose numbers, this is me and the geeking out over the keto and the glucose and ketones, and my glucose without changing my diet at all went from 85 to 139. By the time I was really sick, and my ketone numbers tracked much more slowly. So they went down, but it didn't go down as much. At one point it did kind of tank down to point 0.3, and I worked it hard with fasting. And I literally went a couple of days without eating, and it just cranked it back up and brought that other number a little bit down. Um, but one of the things that I looked at when I went, why is this? Like, why does your glucose have to go up? And I saw someone mention that it was supportive of the immune system a little bit to have your liver says, hey, have some sugar. But rather than me talk about it, like, could you tell us something? Is there like a positive effect of like liver and that glucose response, like in the healing mode?
Yeah, so it's a stress on the body, and any kind of stress on the body is going to put the body into emergency management mode. And one of the things it will do is raise your stress hormone levels, especially cortisol levels. And that promotes a little bit more glucose coming out into the bloodstream because you're going to need that extra energy to fight off that infection. It also usually reduces your appetite. And when you're sick, often your appetite will go down. And so it's anticipating that and it's thinking, okay, we're going to stop you from eating because food processing is another stress on the body. We don't want you dealing with that right now. We're trying to put you in healing mode. So stop eating. We will put the glucose into the bloodstream, and so you don't have to worry about that. You can stop eating. We'll take care of that. And then if you stop eating, the other thing that happens is your insulin levels come down. And as your insulin levels come down, that also shifts your body into healing mode. And so it gives you the energy and the resources to be able to fight off that infection or the injury, whatever's happening. If you're constantly eating and processing food, you can't direct all your resources towards the crisis at hand. And so there are all these like elegant mechanisms that are at play that are kind of automatic when you get sick, that are there to deal with that illness. So the body is very intelligent, and it knows what you need and what you should be doing to take care of yourself. And if we pay attention to that, then we do a lot better.
Wow. Yeah, I experienced it. And plus this whole week, I haven't eaten much, even in the hospital, while they were monitoring me and giving me antibiotics and things. And it was starting to work, but they kept expecting me to have trouble walking around and like, do you want a chair to have us come out? Because I hadn't eaten 4 days. They expected me to be weak. And I was like, no, I'm fine. Like, I'm literally like, I know I'm energetic. I don't feel weird. I'm not dizzy when I stand up. And it was really odd. And I thought, wow, this has got to be the intermittent fasting, or the fasting, because I wasn't eating much, at all. And I thought, wow, that if anything speaks well to this, it was this experience.
Well, I'm glad you came through it. Okay, you're feeling better?
Much better. Yeah, like, no, it's actually, like, amazing. 2 days ago, I was like, "Oh, I don't know if I'm gonna be able to, handle
Yeah.
things," but I'm home, doing great. Yeah, so thank you for asking.
I'm glad. I'm glad.
This is from one of our viewers. And I know you've been asked this before, but she wonders, do you think a 24-hour long fast is the best length, or are there other lengths you consider to be effective? Just expound on that.
So it depends on your goal. It depends on who you are and what your goal is. So it's all very personalized. So for example, I have some patients where I wouldn't want them to fast for 24 hours, depending on their particular situation, and others where 24 hours might not be long enough. So I use fasting strategies on top of a ketogenic diet. So when I use fasting, and I use it quite a bit as a tool, it's often in combination with a ketogenic diet. I usually, if people are open to it, I usually recommend the ketogenic diet first, and that they follow the ketogenic diet for at least 6 weeks, maybe even 12 weeks, to get fat adapted so that their body becomes really comfortable burning more fat for energy. And then then and only then do I usually layer fasting on top of that if needed. Because, once you're fat adapted, often you will naturally start to, space your meals out more, and you'll stop snacking, and, you may not be hungry first thing in the morning. So you may naturally find that you're eating less frequently and that you don't need to intentionally fast in order, you know what I mean? But I have, quite a few patients with food addiction issues, or, certain habits that are really ingrained. And if they're not meeting their goals, let's say they've started a ketogenic diet, they've adapted maybe 6 to 12 weeks, but they're still struggling to meet their goals. I might, and their insulin levels are still running too high, or they're still having a lot of insulin resistance, not getting good appetite control, not getting good mental health results, and especially if they're trying to lose weight and they're not, and they're feeling stuck. Then I will often layer meal timing on top of the ketogenic diet to give that extra, the extra insulin reduction benefits that come from giving your body a break from food processing in between meals. So, and let me give a different example. So, somebody that I wouldn't want, for example, perhaps to fast for 24 hours or longer would be somebody in very fragile health, or who's taking certain medications, or who's already, or, so therefore may not do well with that sudden drop in insulin, or if they're, and in blood sugar, or blood pressure. So when you fast, your insulin level, it really drops insulin like a stone, right? So ketogenic diets, when they're properly constructed, will drop insulin, but nothing drops insulin more effectively than fasting, because everything you eat raises insulin to some extent, right? So when you don't eat at all, the insulin level comes down, and comes down very quickly. And for some people, that's a shock to the system, depending on what medications they're taking, and also depending on what diet they're eating when they start the fast. So if you're eating a really unhealthy, kind of common, typical diet that has a lot of refined carbohydrate in it, maybe has 300 grams or more of carbohydrate in it, and a lot of things are refined, your insulin level is going to be running really high. And then if you fast for 24 hours, it's going to be a big shock to the brain and the body to plunge yourself that low on your insulin levels from that high, right? So there have been situations I've seen in clinical practice where a fast can really make people feel pretty awful, in terms of lightheadedness and blood sugar drops and things like that, if they're trying to do it in the context of an unhealthy diet. But once you're fat adapted, intermittent fasting becomes a breeze, because naturally your body can dip into your fat stores when you're not eating, and it'll keep you stable and steady. Your glucose level isn't going to be dropping. It's already going to be at a nice low level. Your insulin levels are already going to be down. So it's not as much of a stress on the body to then go for a longer time without eating, if that makes sense.
That's like the best answer I've heard about fasting ever. It makes total sense, and I know she'll really appreciate that, and a lot of our viewers will too. So that's
good.
That's what I love about you, Georgia, is like you do explain it, so it's not like too high tech speak for people who are new to keto, or who have a rudimentary nutritional background like me, like who were raised on Doritos.
What good is the information if people can't understand it, right? So it's just like, we're all three of us here to help people, and so I'm glad that you.
Yeah. So my question now is about like, say when you have to go to the hospital or inpatient or whatever it is, you're gonna, or even just a visit to like a GI doc or things like that. There's a lot of traditional advice, like for example, fiber. So I got a lecture about I need to eat fiber because it's going to help what I'm doing. I'm like, okay, thank you, I appreciate the advice, but I basically what I say is I'm really sensitive, and it would take me weeks to get used to fiber. Like literally, I'd have to work up to it, and I would get there, but it would take me a while. But thank you, I don't. Do you have tips for people that in that setting where the doctor is saying something completely contrary like that?
Yeah, you're right, of course, that, most doctors don't know very much about nutrition. I mean, we really don't get, I mean, I think in medical school, I know I say this a lot, and so I'm sorry if you've already heard this, but maybe some of your viewers haven't. But, I think we got 2 or 3 hours worth of nutrition education in 4 years of medical school. Most of that information was incorrect. And we didn't talk about nutrition once during 4 years of psychiatry residency. I mean, doctors just don't, it's not part of our curriculum to learn nutrition. So getting nutrition advice from a doctor, is kind of like going to a dentist to get your car fixed. It's really not going to be very helpful to you. And so I think what you did is something that I often recommend my patients do is to say thank you very politely. Thank you for the, thank you for your, for the information, and just take it at that. And if it becomes an issue where you're working with a clinician who is really very upset with you for not following a particular recommendation, or feels that you're not being that you're not respecting their advice, or that you're going against their medical advice, that sort of thing. I mean, I have had a few patients in that situation, and sometimes they even need to change clinicians, but most people can't easily change clinicians, right? I mean, it's hard to find somebody that takes your insurance or that has openings, or, and sometimes you really like a lot of things about working with that clinician. You don't necessarily want to kind of throw the baby out with the bathwater. So sometimes it helps to, give them resources, offer them, say, well, I'm coming from a different perspective because I have different information, and if you're curious to know where I got that information, I'd be happy to share that with you if you want to see where I'm coming from, right? And so if you say it respectfully like that and offer more information, sometimes that will be helpful, because if they don't have the time or the interest, they're often willing to let it go at that point. But if they are a little bit open-minded or curious to know where you're coming from, they might take a look, and then it will foster a more productive conversation about the topic. So it really depends on the clinician, but I do understand that most clinicians do not have time to learn more about nutrition. They are overwhelmed as it is, and they have certain pieces of information about nutrition, these little tiny bits of information, most of which are incorrect, and that's just what they know how to give. So respectfully declining to take their advice, and hopefully they will continue to work with you and respect that you're coming from a different place.
Great. Yeah. No, I can say there is a little hope in like this last volley of things I went through. One doctor was the complete negative in that I was doing all of those things you mentioned. I was not respecting his advice. I was being, and I try to be, I get emotional, but I try to be nice and polite as much as I know, because I know I respect their opinion, I respect their experience and the knowledge, all of that, but there was hope because the GI doc actually said, "Oh yeah, no, you shouldn't be eating vegetables right now." And I thought, "Wow, that is so nice." She goes, "Yeah, those that little digestion problems for you right now, personally, will cause you issues, and you want to back off for now." And they also gave me a meals like once I started to eat yesterday, that were fine. It was eggs and meat, and they actually were okay with that. It was the weirdest experience because that's not been the case in the past. So
It's hard sometimes if you have better quality information than the clinicians who are taking care of you do. But that's often the case. I mean, oh my gosh, I have patients who know more than I do about certain things, and that's how I learn. I wouldn't have gotten very far if I weren't listening to them. And the internet now, and everybody's got access to lots of great information, and I can't possibly know everything. And so it's great when I find it nice when people come to me and say, "Hey, did you know about this?" Or, "Oh, I've got a different opinion. Did you know about that?" I happen to love that, but I'm also a psychiatrist who spends more time with people. I'm also naturally interested in nutrition, so, it's challenging, but I think what I often will tell my patients is, all of us doctors who are working with you, we're just advisors, right? You are the one who gets to make the final decision. You are the one who gets to take that information, weigh it for yourself, and then it's your body. You get to decide what you do, and you take everyone's information, and then you make the final decision. And I think sort of viewing doctors as advisors rather than, people who get to have the final say, I think that's helpful too.
I'm so moved by what you just said. I've met so many psychiatrists over the years, and it's just very refreshing to hear you be open to learning from your patients instead of the typical, sorry, I keep screwing up the screen here, but it's always, for most psychiatrists I've encountered, it's this kind of hierarchy. So it's just, your patients are so lucky to have someone who is willing to have an open mind and not do that. And that you see yourself as an advisor and not a dictator,
Oh my God, absolutely. Sorry you've had that experience, because I know a lot of great psychiatrists who view the world this way, but of course not everybody does. In every field you'll find that. In every field you'll find the people who, are less open. But I would encourage, your listeners who are working with a mental health professional right now, that if they're not feeling like their mental health professional is listening or open enough to have a productive relationship, that they think about maybe trying to find somebody else to work with. But again, it's not easy often to find somebody else to work with. So sometimes you have to have those hard conversations where you ask questions and try to bring new information to the table, and maybe even share. A good mental health clinician of any kind is going to want to have that dialogue. Like, how do you think things are going between us? Because the relationship is what it's all about. In mental health, well, any kind of medicine really, except maybe surgery or anesthesia.
Pathology. They don't talk back to you.
There's no dialogue. But most clinicians, in terms of a good working relationship that's going to be promoting your health, the relationship is key. And if you feel like if they don't trust you or respect you, and you don't trust or respect them, and you're on two completely different pages, how are you really going to be able to, get where you're trying to go in terms of improving your health and your knowledge and the quality of the advice that you're getting? So, yeah, I don't know where I'd be without listening to my patients. How would I have learned anything?
Anyway, so he was open to learning about it, but he's kind of on his way out. So I'm willing to wait. Sometimes it's, if you're not at the point where you have to change someone per se, but if you get on the wait list for someone who, it seems like all the psychiatrists who are skilled in ketogenic, expertise, or most of them have filled practices, right?
Yeah.
So you can always just, and Michael has his own amazing story about that kind of topic, but you could ask to be put on the wait list for someone who would listen to you, and have that in the back of your head that, it might not be right now where you can make that change with the clinician, but at some point you can. So it's just my 2 cents. I don't know.
Yeah. And make sure you give it a go in terms of having a conversation with them about how you're feeling first, because sometimes that will be really useful and healing in terms of, if you're afraid to bring it up, if you're shy or afraid to bring it up, but you give them a chance, let them know how you're feeling about it, and see if maybe that can get you to a better place together.
Yeah, and that's a good idea. Yeah, give them a chance. Don't cut the cord right away.
Yeah.
They might surprise you, right? Like, I didn't think my psychiatrist would be interested, my current one. I just didn't think he'd be really that interested in metabolic psychiatry and the ketogenic diet. And he totally surprised me, and he wanted me to send him a bunch of information, and I was so happy. So,
wow, that's fantastic. I do think there is some, curiosity among a lot of clinicians. So if you can go there from a point of curiosity, as opposed to, it works both ways. Like telling the clinician that this is what I do, and this is why, and everything you're telling me is wrong. That's going to put people on the defensive. And just as if a clinician were to approach you that way. So, and also, I don't know if it's useful. I have a document that I prepared for my clinician training program that explains fairly briefly, the scientific and clinical rationale for using ketogenic diets in mental health. It's available, I think, through the Metabolic Mind website as well as through my own, or directly through me if you want me to share a copy with you that you can share with your listeners. It just explains, why a ketogenic diet makes sense to consider, and has lots of live links to scientific articles if people are curious to learn more about them.
Great. I love that you said in the Metabolic Health Initiative Q&A recently, you said that you're nutritionally pro-choice, and you've said that elsewhere, and I love that phrase. And then you said, I want everyone to have a seat at the table for better brain health. So, you know my history. If a patient wants to do a vegan ketogenic diet, what would you advise them to focus on despite your preference for animal protein? Just a few things.
Yeah. So, and I go into a lot of detail about this in the book because I do mean what I say about that. I mean, I have information about food that suggests that it's ideal, it's optimal to include animal foods in the diet, but lots of people don't want to do that. And so, but there's still plenty of things you can do to make your diet brain healthier without adding any animal foods to it. And so, the first step is doing all the things that all of us need to do, which is taking all of the junk out, right? So all of the processed foods and the packaged and the cans and the bottles, everything, and just getting yourself down as close as you possibly can to whole foods. So if you're not eating animal foods, whole foods means whole plant foods, right? And so this means, fruits and vegetables. Now we get in, and nuts, right? And seeds. And so you need protein sources. And one of the best things you can do is if you're following a vegan diet is to make sure you're including some calcium set tofu in your menu if you can tolerate that, if you do well with that, because it's a complete source of protein. It's got all the right mix of amino acids in it, and it's also got some calcium in it too. And it's of course very, very keto friendly because it's extremely low in carbohydrate. So so choosing the part of the challenge with a vegan diet for ketogenic diets, as you know better than probably anybody, is that it's hard to get your protein needs met through low carbohydrate foods, because a lot of the protein sources are things like beans and lentils and peas, and even some nuts can be higher in carbohydrate. So it's hard to get your protein needs met while keeping your starch down. And so that's where you have to turn to things like tofu. It's not the only example, but I think one of the best examples. Making sure you're using nuts as opposed to legumes, because legumes are very starchy, whereas nuts are, especially certain types, are more protein than carbohydrate and higher in fat. And so understanding, choosing your protein sources, choosing low carbohydrate protein sources. And the other thing is to make sure that you're supplementing carefully. I've worked with many, many folks over the years, especially on college campuses, young people who follow vegan diets primarily for compassionate reasons. And so, less often for health reasons. And most of them knew to supplement B12, but most of them didn't know really what else to supplement with. And so I think that's just because sometimes the nutrient issues are downplayed. And so I think these really do need to be highlighted. There are actually quite a few nutrients that need to be supplemented. And one that I think is especially important for people to know about is the omega-3 fatty acids from algae. So algae-based supplement of omega-3s, not flaxseed, not chia. And, you really can't get the right omega-3s from plant foods. The DHA and EPA that we need in order to be healthy, the omega-3 fatty acids we need do not exist in plants, but algae is neither a plant nor an animal. Exists in this it's this special state-of-the-art hybrid kingdom, right? So it's not a plant. It's also not an animal, but it has omega-3s in it. Now you can't just eat the algae and get the omega. You can't extract them, right? We can't extract them from seeds or anything else. So you have to take a supplement that has been extracted, from the algae, but please do that. Take if you're, so, and there are lots of other examples, but I think it's really important to research, do your homework and research which nutrients you're going to need to supplement on that vegan diet to make it nutritionally complete and healthy over the long term.
Great. Super helpful.
Wow. Yeah, that's great. So my favorite topic in the book, Change Your Diet, Change Your Mind, is insulin resistance. And specifically, the goal is to be less insulin resistant, right, over time. But one of the things that I hear talked about is that, I'm sure just like everything else, it's kind of it probably fluctuates up and down depending on a whole bunch of factors, but that you actually the thought is, and this is a deterrent, which I don't like to a therapeutic ketogenic diet, that maybe you become more insulin resistant because they know if you stop, you do rebound quite a bit, and I mean I know that personally. So, do you have any thoughts on that? Because it scares a lot of people to hear things like that, and they're like, "Oh, well, we can't do this long term. This is not safe." You know what I mean? You become more insulin resistant, and you rebound, and it's worse than you when you started.
Well, my goodness. If you ask somebody to stop drinking alcohol, and then, which is difficult to do, and they feel much better and they're so much healthier and everything works better, and then they start drinking again, well, it's not going to be fun. And so it's really, really important. I think helpful when I'm working with people is to never say forever, right? So I just say, let's do an experiment. Let's get curious about what's possible for you on a ketogenic diet and see how you feel before you start thinking more long term about it. Because if you've never tried it before, it sounds just impossible. It sounds like, oh my gosh, how could I ever live without XYZ PDQ? How could I ever, am I going to feel miserable? Are there going to be cravings? How am I going to, what if? And well, let's give it 6 weeks and then we can talk about it, right? Because if you can get through the keto adaptation process, which, sometimes takes a little support and education and sometimes even some medication tweaking to do, that's a lot of what I do. So if you can get people safely and comfortably through that keto adaptation period, some people do fly through it with flying colors and don't need a lot of help from me at all, and others need a lot more, support. If you get them through that and they experience that shift, in metabolism from mostly glucose, mostly carbohydrate, to mostly fat in terms of energizing your body and your brain. It's usually, I'm sure both of you can attest to this, it's a really noticeable shift that, and most people have not experienced it before, and it's really a different state of mind. And so most people can't even imagine not wanting XYZ PDQ. Most people can't imagine what it feels like. Oh my gosh, I can go for 6 hours, 8 hours, 10 hours without being hungry. Who am I? What is this? My mood is stable. I don't get cranky between meals. I can sleep through the night. I'm not tired all the time. And my brain is clear. Most people, if they felt a certain way for a very long time, it's just hard for them to imagine what that feels like. So the only way to find out is to do it. And then we can talk longer term, right? Like, because once you experience it, that you usually have a very different conversation about, why it might be worth it to keep going. And it's totally up to the person whether they want to keep going. And then if they relapse, which lots of people do, they take, I say the diet gets interrupted. If the diet gets interrupted for any reason, there are all these strategies you can use to get back on that are pretty painless and pretty simple. And the more often you kind of slip and you learn, that's how we all learn. We practice, we get better at things. You maybe slip 4 or 5 times, and each time you get better at it. And each time you get to decide, well, do I want to go back to that diet or not? And most patients, most people, including me, get at it and they want to keep going because they feel so much better that it's actually worth it to them.
broadly speaking, I hear a lot, been fortunate to talk to a lot of people, similar conditions and things. Um, there are lots of medications like valproic acid, is if I'm saying that right, or that work great. And I think on a recent interview, I heard you mention something about the ketogenic diet possibly maybe affecting the effectiveness of medicines such as that. And am I right?
That's okay. No, the ketogenic diet and medications, they have a lot of interactions. So, a big part of my clinician training program is helping fellow clinicians understand as much as we know, because we're still learning, right? About what happens. So, let's say you're taking a medication like valproic acid, which is also known as Depakote, or valproate. Sometimes it's spelled out that way. So if you're taking a medicine like that, which is a mood stabilizer, a very common anticonvulsant mood stabilizing medication, and let's say you've been stable on that medicine at a certain dose for a year, and then you start a ketogenic diet, right? Well, all of your chemistry is changing on a ketogenic diet. It's a powerful biochemical intervention, a powerful metabolic intervention that actually changes your body chemistry. And so that's going to have an impact on your medications, not just levels. Sometimes the blood levels of medications, including the blood levels of valproate or Depakote, can go down on a ketogenic diet, right? And so there's that issue. But then there's also the fact that the way your body processes that medication is going to be different because your chemistry is fundamentally changing. And so watching out for, say, for example, side effects of that medication might appear, you might feel more sensitive to that medication on a ketogenic diet because the ketogenic diet mimics a lot of the effects of medication. So one of the things that valproate does or Depakote does is that it changes the balance between two neurotransmitters in the brain, GABA and glutamate. Well, so does the ketogenic diet. So now it's as if you've taken the one medication and you've taken your Depakote medication, your valproate medication, and you've added your keto medication, and now everything feels too strong. And so that even though the level may have come down, the blood level may have come down, it may be feeling too strong. So it's very common in my work to have to lower psychiatric medications as the person is adjusting to the ketogenic diet so it'll be comfortable for them.
Okay, I liked how you said keto medicine. Like I've never heard those two words together, but that's exactly what it is. So that was cool. I picked up Michael's questions. What's the number one mistake? The number one mistake you see people make regarding the ketogenic diet for brain health? What's the number one mistake?
I'm going to give you two.
Hey, I'm up for it.
They're equally common. So when people tell me, and I've consulted with, I don't know, hundreds of people about ketogenic diets for mental health in recent years. And when people consult with me and say, I tried a ketogenic diet and it didn't work, or they say, I tried a ketogenic diet and it made my mental health worse, right? 9 times out of 10, it's one of two things.
Okay, good.
So 50% of the time, or 45% of the time, it's that they didn't try it for long enough. That they did it for a few days, they felt much worse, and they stopped because it was so uncomfortable, right? And it felt like everything, they were getting more anxious or more irritable or more depressed or a little manicky or whatever it was. They couldn't sleep. They're like, oh, this is bad. This is bad for me. I have to stop. Now I understand why they do that, but there are solutions to those issues if you're working with somebody who has some experience and can guide you through that period of time. So the number one issue is that they didn't try it for long enough and gave up, because they didn't know how to approach the diet in a more comfortable way, right? So that's number one. The other one, which is also neck and neck with the other one, is that they weren't in ketosis. So they went on a keto diet, but it was actually just a low carb diet. And all they did was lower their carbohydrates, to say maybe they lowered it, to 20, 30 grams a day, which is what most of the internet sites will tell you to do. And most of the weight loss books will tell you to do, right? But you weren't in ketosis and you don't know because you weren't measuring ketones. You were just counting carbs. And the issue there is that, so why weren't they in ketosis? So they weren't in ketosis because carbs aren't the only thing that raise insulin levels. So you can have, and you've got to get your insulin levels down to be in ketosis, not just your carbs. So there are some people, if you lower your carbs to say to 20 grams a day, right? Most people would call that a ketogenic diet, but I would say that at least 50% of people who do that are not going to get into ketosis. So you lower your carbs to 20 grams, but you're still eating tons of protein and you're eating 6 times a day and you're not exercising. And so your insulin levels are really high because protein raises insulin levels. All foods raise insulin levels to some extent. It's just that the carbohydrates raise them the most. So if you get your carbs down to a nice low, say 20-ish, but you're still overeating all kinds of other things, your insulin levels are going to be high all day long and you will never get into ketosis. And if you don't get into ketosis, you're not going to see, in most cases, the benefits that you were hoping for.
I'm so glad I asked that question because those are super helpful answers, even for someone who, like me, who I thought I kind of know a little bit about this now.
You know a lot. You know a lot about this.
That's just really helpful because I know it's supposed to be moderate protein, and a lot of people have different definitions about moderate, what that really is, and I mean that's just the tip of the iceberg. But that's a very helpful answer. Wouldn't you agree, Michael?
Absolutely. Yeah, no, I think a lot of people eat too much protein and they expect to be in ketosis and they're not,
Yeah, and dairy too. So dairy is another major culprit with insulin, and so is powdered ingredients and whey protein and certain sweeteners. Lots of culprits out there in terms of raising insulin levels. So carbohydrate's not the only thing that can raise insulin levels. So I think this is probably the most important thing, is to measure those ketones and make sure you're getting into decent ketosis before you say that it didn't work.
Absolutely. I can tell you right now that the measuring is the thing that saves me the best. So I have a question that I get out from people, that comes up. Unfortunately, it breaks my heart, from parents that have, unfortunately, children from, say, 10 you know, or older with really serious mental health issues and are actually hearing about keto. What advice could you give a parent that might make them feel a little bit better about maybe reaching out to find a different provider than who they're using? And, they have kids, unfortunately, with multi-pharmacy, polypharmacy, and they're not improving, and they have other comorbid things that go with it.
I get asked this all the time by parents who, I'm not a child psychiatrist, so I don't work directly with children, but I, of course, work with lots of adults, and many of those adults have children, right? And many of those adults have children with mental health concerns, right? And so I get asked all the time by my adult patients, what can I feed my child for better mental health? And, should I do a ketogenic diet? Do I need to see a specialist? How high should the ketones be? Should they be carnivore? And oh my goodness, all these questions, right? And so what I say is, okay, before you even start thinking about a ketogenic diet, I would just encourage you to switch your child to a paleo diet. And the reason why is because kids they may not need to go onto a ketogenic diet, right? They're so metabolically flexible. They're really usually much metabolically healthier than adults are. By the time you've lived 40, 50, 60 years on the planet eating the wrong way, you've got a lot of metabolic damage. If you've only been eating the wrong way for 5 or 10 years, you've got a lot more resilience there, and you can often, just by cleaning up the diet in all of these really important ways. I mean, think of what most kids eat. I mean, most kids are eating the opposite way of what's best for them, and parents don't know that. They don't realize it because they, the information that they have is incorrect. It's not their fault. The information they're given is incorrect. So, if you feed kids whole foods, meats and eggs and poultry and seafood and vegetables and fruits and nuts and seeds, and if you feed them whole foods the way what the foods we were designed, that we grew up, we evolved to eat, foods you can find in nature, single ingredient foods, an egg, a peach, a fish, whole foods. It's kind of amazing what you can see, even without going to a low carb or ketogenic. So I would always start there first, because that, first of all, it's going to be hard enough. If you take out the juice boxes and the cereals and and all the refined carbohydrates, the flours, the sugars, if you take all of that stuff out, sometimes that's all you need to do. But if you did need to go to the ketogenic level, then you would really want to work with a specialist who knows how to safely use ketogenic diets in children, because there are some special considerations in children. Children have different nutritional and metabolic requirements because they're growing. So they need different rules than adults do in terms of how much protein and how many nutrients and all that sort of thing. So, and you don't want kids to be fasting, and you don't want kids to be, under eating protein to try to get into ketosis, and some of the funny things that adults sometimes try to do to get into ketosis.
So this is about exogenous ketones. I know every podcast you get asked an exogenous ketone, so we had to do it. Okay.
Ask away.
I'm interested. I've taken them before, and someone said to me, I'm not sure if people who have bipolar disorder should take them because it can cause mania, and I hadn't heard that before. I'm curious what your take is on that.
Interesting. So exogenous ketones, well, first of all, there are a lot of different types. So there are salts, there are esters, and now there's even pure beta-hydroxybutyrate ketone supplements. And so some of these are more powerful than others. So the ketone salts are generally pretty mild. They might raise your ketones by maybe 0.5 to 1 millimole at best, and only for about 90 minutes or so. So there's that. And then the ketone esters are very powerful. So they're going to raise your ketone levels by maybe 2 millimole or maybe even 3 millimole, but again, for about 90 minutes, 2 hours. So if you're, so the ketones, the potency of them varies a lot. And so the milder salts are probably nothing for most people to worry about. But I think that you could theoretically see, I haven't seen this because I haven't done a lot of this. I haven't given a lot of people with bipolar disorder exogenous ketones just to see what happens. Right. I tend to use nutrition approaches first. But what you could theoretically see is if someone has a history of bipolar disorder, manic episodes, and especially if they're not taking a medication at the time, and so they have a vulnerability to shift into mania or hypomania, and you give them an exogenous ketone, theoretically what you could see, especially if it's a potent one, is you could see brain energy levels really spiking. Because those ketones will cross into the brain and they will be absorbed very hungrily by brain cells. And it could rev up metabolism in the brain in perhaps an uncomfortable way. Now, again, this is only going to last 90 minutes, but also, and I think that it really depends on the individual, where the individual was at in terms of their mood when they started this experiment. So are they already on the manic-y side when they take the ketones? That's probably going to be a higher risk. Or are they on the depressed side? So lots of different things. And are they taking a medication, which is going to suppress that reaction? So lots of different factors. But so I do think that theoretically there is that risk. And so people should be very careful using exogenous ketones, especially the more potent ones, if they have a history of manic or hypomanic shifts.
Sure. And I have a follow-up to that too with MCT powders. That's great for adaptation. I know personally in coaching and the training and all that. Does it have the same hour 90 minute as the liquid?
Yes. Yeah. Oh, the powders versus the liquids?
Yeah. Like the is that right? Is that the esters versus the powders? I don't know if I have that 100% right.
Yeah, so no, that's okay. So MCT, so medium chain triglycerides, they're not ketones themselves. So what they
Right.
are is right. No, and just for your listeners, right? So
Sure.
to make the distinction. So I know I know that you know already. So there are ketone supplements, the salts and the esters, and the pure beta hydroxybutyrate, those ketone supplements, and then you have MCTs, or medium chain triglycerides, and these aren't ketones, but they're just shorter fat molecules that take less time for the body to chop into ketones, right? So they turn rapidly into ketones in the body. And so they boost ketone levels pretty quickly, just like the ketone supplements do, but they're just very weak in terms of their ability to do that. So, they might raise ketones, maybe by 0.3, 0.4, 0.5 millimole, about half as well as one of your better ketone salt supplements can. So they're very, very mildly ketogenic, but they are, as you said, very useful for helping people transition. They can be very useful for helping transition onto a ketogenic diet by supporting slightly higher ketone levels, and also increasing the fat to protein ratio in the diet. So they can be really useful.
And personally, I can say I think it actually helps with the energy levels too during that adaptation time. Yeah.
Absolutely. Exactly. That's how they work, is they support those higher ketone levels, and those ketones get swallowed up by brain cells and used for energy
So
and
less
other cells.
keto flu.
They're really powerful though. If I take even like a teaspoon more of what I'm used to, I get stomach aches. So I had gotten up to 7 tablespoons a day.
Oh,
Took me a
wow.
really, I know I'm not doing that anymore, and but that's a whole other podcast episode topic. But yeah, I mean, they're powerful in and of themselves, these MCT oils. So, but I
Well, a
love them.
lot of people don't digest them well because they are
Yeah.
they are highly refined fats. They're a refined oil, just like a vegetable oil is. So that they're not a natural thing for us to be consuming. So they are hard on the gut, and so a lot of people have a lot of trouble digesting. Just like you did, you have to start a really small dose and work your way up. Don't just start off with even a table.
No, that would be very mean to do to anybody. And I just got
Yeah.
a vision from your wonderful presentation at the conference. One of the best slides that we saw as attendees was you had a picture of like refined oils. In your presentation? Do you remember that, Georgia? And it was like really scary looking, and there was like a basement with graffiti on it, or I don't know. It was just really scary. It made me not want to have refined oils ever again, but I still like my MCT oil. Just not, balance it out with whole foods like you were saying before, and not have it just
Yeah, although
processed.
there's a huge difference between taking small doses of MCT oil and pouring vegetable oil all over your
Right.
food all day long.
Right.
And MCT oil does not contain linoleic acid, which is the dangerous omega-6 fatty acid that is the excessive amounts of it are found in the vegetable oil. So you don't worry about that piece of it.
Right. And your
Yeah.
book, really, I learned a lot about oils just in your book alone. I mean, you really go into detail about it in an easy to read way. So if you want to learn
Good.
about oils, everybody, I forgot which
So
chapter, but it's in this
Yep.
book right here.
So my last question, before I was fortunate to have my doctor, Dr. Bernstein, I was waiting for an appointment with him. I tried supplementation a lot, and it just and like, for instance, I'll give you one example where once I had my meeting with Dr. Bernstein and I went through the supplements I had been trying, and one of them really tripped me up. I was taking 10 times as much, and this is awful, and don't do this anybody, but like methylene blue, because you're on the internet and you hear, and it worked. I mean, oh my God. But the doctor that actually said it, I'm not going to out him or anything like that. He literally, I watched the YouTube video again, and it was an MD, and, he was maybe alternative and all that. He had a weight calculation. It was awful. And Dr. Burns said, no, 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 no. I'll give you one that's a smaller, the right amount for you, and it's in a prescription, and it's in a place that makes it that's regulated. But the one that really surprised me was tryptophan. I would have thought, oh yeah, that's in Turkey. You hear about that at Thanksgiving. And he said, that's a serotonergic, thing. You shouldn't be using that. Do you have comments on that that might help people?
Yes. Another thing that I teach in my training program is about tryptophan and serotonin. So serotonin, for your listeners, is it's a neurotransmitter. It's a brain chemical that cells use to communicate with each other, and it's associated with things like mood and sleep and energy and sexual appetite and things like that. And so it helps us regulate a lot of our body functions and our mood. So very important neurotransmitter, and the brain makes it out of tryptophan. So tryptophan is an essential amino acid that comes from dietary protein. We can't make it ourselves. We have to eat it. So the tryptophan, in order to cross into the brain from the bloodstream, that amino acid, it has to use a transport molecule to carry it into the brain. And so there are two types of supplements you can take to support serotonin levels in the brain. So one is L-tryptophan itself, which has to get onto that carrier molecule. And then there's 5-HTP. And 5-HTP does not need that carrier molecule. So, it has better availability. It's easier for it to cross into the brain, right? So sometimes people with depression will use these supplements to try to boost their serotonin levels in the brain. So the L-tryptophan and or the 5-HTP. Yeah. Now, just like a serotonin medication, like one of the SSRIs, like Prozac or Zoloft or Celexa, Paxil, lots of different garden variety antidepressants out there that also boost serotonin activity in the brain. If you have a history of bipolar disorder, those medications and those supplements can be potentially dangerous because they can trigger a manic episode. So it's really important to be aware of that and be careful. I wouldn't generally recommend those supplements to somebody with a history of bipolar disorder, just like I wouldn't necessarily recommend an SSRI.
And I can tell you that the experience of the was bad. It really was. It didn't last. I stopped it and it went away, but I really felt it like immediately. And I just cautioned people, please don't, if you have something like bipolar or schizophrenia, don't mess with, don't mess with supplements. Talk to your doctor and they'll help you, hopefully.
Yeah.
These are
I mean,
real chemicals with real effects. Just because they're natural or just because you don't need a prescription for them doesn't mean they're not real chemicals with real effects. And so I'm really glad that you brought that up, Michael.
me too. Okay, can I ask one last yeah, and it's kind of a selfish question, but okay, good. And you have to tell me if anyone's asked you this before, but I am dying to know, what was the pivotal moment that made you want to be a psychiatrist?
Wow. Oh my gosh. So I don't think anyone has ever asked me that before. I mean, not on a podcast. People ask me, like, why in the world do you want to do this? Well, actually, when I was in medical school, I was really torn in half by, I really could not decide what I wanted to do a residency in. And it was getting down to the wire, and I just couldn't decide. And really what I was torn between, as strange as this sounds, was psychiatry, which is very much a people focused, and a lot of people would think kind of a softer science and not really a hard. It's not, psychiatrists aren't real doctors. They just talk to people all day long and they guess about medications, right? So a very, very kind of weakly biological or sort of weakly science, but not really based in a lot of science. There's that.
Mm.
Versus pathology, where you barely people at all, and you're looking at tissue specimens under microscopes, and you're just like, I could not decide. I was completely torn. So for that and for some other reasons. So, I was really torn. I was really torn in half by whether I wanted to do something really, really purely scientific almost, and purely kind of psychological and human relations, right? And so I was really stuck. I eventually, obviously, decided to do psychiatry. And two reasons. One is it just came naturally to me because I love talking to people. I love I get this from my mom. Like, I'm a people person, right? So I found it fascinating, to listen to people's stories and, try to understand where they were coming from. And just the mind is just, such a fascinating thing. But the other reason was I was like, this field isn't very scientific. So I want to get to the bottom of some of these. I'm kind of curious, like, how does the brain work? How does the mind work? What causes hallucinations? I was just fascinated by that. I thought, well, I'd like to learn more about that. Well, then lo and behold, I go into residency. You actually didn't learn much about that at all.
Oh, no.
So, it was a little disappointing that way, but I really, it's because I'm fascinated by people. And the other reason, to be perfectly honest with you, is that I looked at the psychiatrists who were in my hospital that were running the training programs and that were taking us on rounds and that were did these clinical rotations, and I thought, I like these people. Most of them, I like them. They're interesting people. They seem to genuinely enjoy their jobs. They are genuinely interested in other people. I think they were some of the nicest people that I'd met, and also most interesting. But they also had a really good lifestyle. And I saw some of these internal medicine people. They're on call all the time. They're exhausted. They're working 100 hours. And I thought, I can't do that. Can't do
Yeah.
that.
Well, we all benefited from your decision, and it's funny because my niece is training to be a pathologist.
Oh, really? Oh, that's fun.
Yeah, so it's kind of funny. I'm not quite sure how she came to that decision, but I'm glad you decided to be a psychiatrist because you're helping so many people every day. People you don't even know who you're helping, but it's growing every day. And it would be amazing to have you come back and we could stump you with some more questions you've never been asked before.
I have to say, you're both new to podcasting, right? I have to say, you've asked me some of the best questions, and it's really enjoyable. So I really appreciate it. And I think it's partly because you're coming from a lived experience perspective that you're asking different kinds of questions that I usually get asked, and hopefully more helpful, to other people out there who are living their experiences, who need some hope and some tools and some information. So thank you.
Okay. Oh, thank you so much. And we'll have
Yeah,
your
it was an
book
honor to have you on.
in the show notes and your website and your directory of clinicians. That's so amazing.
Yes.
We'll have all that in the show notes. We're really good about that. So just thank you so much for making this a wonderful experience for us. We're so happy.
Thank you. I really enjoyed it. And thank you for doing the podcast. And thank you for sharing your experiences to give people hope and give people a guidance. I think it's really, really important to have podcasts from lived experience. As you know, for example, with Dr. Ian Campbell and Matt Bazuki's podcast, people need to hear, need to see, need to have role models, and they need to see what's possible. And I really thank you for that.